They are very good at hiding out. They're good at infecting. They're good at surviving. And so it does present a challenge. And every time we come up with a good idea to treat them or reduce the risk, they seem to find a way around that. So it is a constant game of chess, honestly.
Hey everyone, welcome back to VetFolio Voice. This episode, sponsored by Elanco, features Dr. Brian Heron, and we're talking about parasites, which I don't think I've really made it a secret, maybe are not always my favorite topic, and you'll actually hear it a little bit in this conversation. Dr. Heron mentions picking up on a little bit of an ick factor from me when it comes to parasites, and he's right, but it's not just about the parasites themselves, although there's a little bit of that too. But I feel like every time I learn something new about parasites, I'm just blown away by how clever and how adaptable they are, and how they find ways to survive and continue to cause infections despite all of our efforts at control and prevention. I mean, it's fascinating, but it's also a little bit intimidating. In this episode, we focused on tapeworms, and more specifically, Echinococcus multilocularis. And I remember learning about Echinococcus multilocularis in vet school and thinking, that's a bad one. It's one of those diagnoses you definitely don't want to see because it can have serious implications for both people and animals. But thankfully, I've never encountered it in practice, so it kind of became one of those parasites that, I knew it existed, but didn't really think about it much on a day-to-day basis. But true to my earlier theme of how clever and adaptable parasites can be, it turns out we're seeing some shifts in the strain of Echinococcus multilocularis here in the United States, which is leading to different trends in infections and clinical signs from what maybe we've been familiar with in the past. Dr. Heron and I talk about what's behind those changes, the trends that we're seeing both in Europe and here in the United States, and what we as veterinary professionals should be thinking about in terms of diagnosis, treatment, and prevention. So even if you're like me and sometimes have the instinct to bury your head in the sand when it comes to parasites, I get it, but absolutely stick around for this episode. Dr. Heron did a great job of explaining what we need to know about Echinococcus multilocularis so that as veterinary professionals, we can continue to effectively protect both animal and human health. Dr. Brian Heron is an associate professor at the University of Tennessee College of Veterinary Medicine. He graduated from Oklahoma State University with both his DVM and PhD. His current research is on the surveillance of vector-borne and emerging parasitic infections and the control of ticks and fleas on companion animals. Some of his research interests are on early effects of isoxazolines on ticks and pathogen transmission, surveillance of wildlife for Echinococcus multilocularis, and the surveillance of flea-borne pathogens in home infestations. Although his research focus is mainly on ectoparasites, Dr. Heron enjoys working with all parasites of veterinary importance through the diagnostic service at UTK and teaching and outreach opportunities. He is a wonderful speaker. Let's go ahead and get into our episode.
In the age of Dr. Google and conflicting influencer advice, it's important to follow the evidence. That's why the NAVC publishes free veterinary journals for every member of the veterinary healthcare team. Subscribe to Today's Veterinary Practice and Today's Veterinary Nurse for evidence-based clinical insights. Or check out Today's Veterinary Business for practice management guidance and deep dives on the latest industry trends. Visit navc.com and hit the Publications tab to learn more and subscribe today.
I'm excited to have this conversation with you, Brian. Thank you so much for joining me. Although I will say, anytime we talk about parasites, parasites scare the heck out of me. So I'm always there's always like this level of trepidation as we go into these conversations.
There seemed to be, when we had our pre-chat, there seemed to be an ick factor that you were struggling with.
Yeah, I will say it's not my favorite topic, and part of it, I guess you could call it a little bit of an ick factor, but it's not even the parasites themselves. I think it's how clever I keep learning that they are, how they can just find ways to spread and to cause infection and things like that. So I think it's more like this fear of being outsmarted by the parasites.
Yeah, it is a constant battle, and I think that's one of the cool things about parasites in general is for the vast majority of them, they've co-evolved with their host over thousands, millions of years, and so they are very good at hiding out. They're good at infecting. They're good at surviving, and so it does present a challenge. And every time we come up with a good idea to treat them or reduce the risk, they seem to find a way around that. So it is a constant game of chess, honestly.
Yes, that's what it feels like. And so I'm very thankful for people like you who are out there and doing the work to, try to keep us a step ahead. It's interesting when you said co-evolved because I think of parasites like Diplodium and, kind of our common tapeworm. And, we talk about coevolution and how oftentimes they're not necessarily harmful in a lot of cases. They're just more of a nuisance than anything. But we're going to talk about tapeworms in this conversation, but maybe one that's a little bit more concerning than what we're used to seeing.
Yeah, and in terms of parasites in general, tapeworms specifically, you can think of, and if they're in their definitive hosts, which is we're mainly thinking in the vet med, like our cats and dogs, as the definitive host, they often don't cause quite as much disease because they do need to stay in there and survive. Now, when we think about our intermediate hosts, which might be rodents in the environment, it might be okay to debilitate them a little bit. If a rat is a little bit slower, then the cat catches it easier and completes that life cycle. So it's the unfortunate phase of when some of the diseases transition or spill over and humans, cats, or dogs become the intermediate host. And that's kind of the scare of Echinococcus is really we become the accidental intermediate host, and it is debilitating us to try to complete its life cycle.
Oh, that makes so much sense that, yeah, it has to do with the host. And so let's talk about that. We're going to get into Echinococcus a little bit. But I think part of the reason we're having this conversation is because Echinococcus is becoming a little bit more of a problem, which sounds terrifying to me because this was the parasite we learned about in school that was like, this is a big deal. This is a real problem. Why are we seeing spread of Echinococcus? Like, why is this becoming a bigger conversation now? And I guess that goes for just kind of these in parasitic infections in general. I'm thinking, I live in the Southeast and we're not endemic for Lyme, yet we are starting to see it more and more here. So what do you think is behind the spread of some of these parasites?
Yeah, in general, we would say that some of these infectious diseases, they're moving around because of animal movement, human movement. So we know that we're just moving diseases around that, and that's kind of a worldwide concern as we track the import export of animals. There's a lot to do with the climate changing and where those vectors or where those hosts are suitably able to live. We have a lot of reforestation efforts, and so we're moving some historic farmlands to forests, and that encourages the incoming wildlife that had been gone from those areas for a long time. And so movement of animals, wildlife animals, is another key thing. And so I think it's always going to be multifactorial in why these diseases are moving. And that's why we put a lot of effort into studying where the diseases are so that we can put our best guess at risk mapping because it's so complex to determine where these diseases might go next. And sometimes we have an idea, oh, it's getting warmer, it's just going to go north. And then we see Lyme disease kind of spreading south through Kentucky, Tennessee, North Carolina from its historic range over the last 5 years. And so we do try to think about this and go out and look for these diseases to try to get a best risk model.
That makes a lot of sense. And I attribute a lot of it, which is probably my small animal veterinarian brain thinking, people are traveling with animals. And so that's the movement of animals where my brain goes. But, like you were saying, that there's so many factors that play into this. I love to hear about reforestation efforts and things like that. But certainly, there's other things that happen when we go through these efforts. So again, more and more thankful every day for parasitologists who are studying these really complex patterns and trying to map the risk and keep us ahead of the game. I understand with Echinococcus specifically, the coyote population might be playing a role.
Yeah, I think that's part of what we're learning about. Historically, if we're thinking about Echinococcus multilocularis in the US, it was really a fox and they would say a vole or a mole kind of life cycle. And what we're finding now is in areas previously well published in the 90s, Nebraska had Echinococcus there. It was in their foxes, not in their coyotes. And now in these same regions, we're finding, up to 45% of coyotes in Kansas tested positive in kind of a recent work done out of Kansas State. And so I think the transition over to maybe a different reservoir has really pushed its ability to move around what is considered to be the endemic range for Echinococcus multilocularis in the United States.
Does that mean we're still seeing Echinococcus in similar areas to what we've been seeing before, but we're seeing it in a different population of animals?
Kind of both. So we're seeing it in a different population of animals. So spilled over into coyotes, we are seeing that expand the range. And so both in what the wildlife surveillance has shown and in cases recently reported in dogs, we're seeing it further south of the expected range. And so further south currently would be reports in Kentucky, Missouri, Kansas, Nevada, Colorado, also reports further west. There was a case string out of Oregon, Idaho area in dogs. And so it does seem to be kind of just nebulously expanding south from its historic range.
There those parasites go. They're finding a way. They're expanding.
Yeah, absolutely.
And I understand that the strain of Echinococcus is also a factor here, that there is, we've seen this in foxes, and, we're seeing it in a different population of animals, and we're seeing a different type of Echinococcus.
Yeah, I think for anyone who got a lot of Echinococcus information in vet school, you were probably told that, Alaska has some endemic islands, and we had a North American strain, and really the naming of them is not super important, but there's lots of areas around the world that are endemic for Echinococcus. So Europe has a big endemic area, Asia has a big endemic area, and they've tried a lot of ways to kind of deal with those parasites. What we're seeing first documented in Canada and now spreading into the US is all of the information we have right now suggests that this is an introduction or multiple introductions of European strains of Echinococcus multilocularis. And that potentially is why it's able to spill over to a different host, because it's not the parasite that was here host adapted to our canids, right? And so what was a fox cycle now is spilling over to our coyotes. And that really has allowed it to expand its range. And so I think not only studying where the parasite is, but making sure we have a good understanding of where it came from. And like I said, we think there's some introductions from Europe bringing a different strain, which may be more transmissible, more pathogenic than the historic North American strain that was just kind of settled there and it existed and you talked about it in vet school, but you never thought about it again. And now it's coming to the forefront because this is probably a much scarier version of Echinococcus, which is already a scary disease.
Oh boy. I knew this conversation was on my radar this morning, and I went, oh boy, we're talking parasites, and this is where that ick factor comes from, of not the parasite itself, but the clever nature, the ability to expand. And it feels like with the expansion tends to come higher risk. And it sounds like that's a little bit of what we're seeing right now. So rather than bury my head in the sand, which is what I sometimes want to do when we're talking about parasites, let's talk about it more. And what are we seeing? What are we doing about it? How can we, be as safe as possible with this parasite that can be a bit more dangerous? So starting with transmission, how is Echinococcus transmitted? Is it fecal-oral, or are there other methods of transmission?
Yeah, so both Echinococcus species in the U.S. have an intermediate host. So we're talking about Echinococcus multilocularis predominantly here, and that involves a rodent intermediate host. And so there's lots of mice, voles, muskrats even can kind of fall into that category, and they're the intermediate host. Dogs, coyotes would become infected and get the adult tapeworms in the intestine if they ingested an infected rodent. So those dogs that are out hunting around or have access to wildlife are going to be the highest risk for getting the adult stages in the intestines. Now, where I mentioned earlier, humans and dogs become accidental intermediate hosts, that's the scary part, right? In which that would be ingestion of eggs from canid feces. And then we would get the alveolar cyst stages, often in the liver, but can be in a lot of different tissues. And when I talk about this, I often get like well, good, I'm at low risk because I'm not out there eating coyote poop, so I'm completely safe.
I'm happy you're not.
Yeah,
No one's
yeah.
out there eating coyote poop. That's
I
good
would
news.
encourage, to
Yeah.
not do that. But what we're seeing is, probably similar to lots of these parasites that gets transmitted, likely due to contaminated vegetables, contaminated produce, infected like water source things. Now, unfortunately for our dogs who are indiscriminate and do sometimes eat poop, that is a good way for them to get it. And again, ingestion of those eggs leads to the really damaging, debilitating disease of alveolar echinococcosis, which again, most commonly infects the liver and causes a lot of damage throughout that tissue.
That makes sense that, make sure we're washing our vegetables and things like that. And sometimes, I don't know, I feel like it's maybe it's because I'm a veterinarian. I feel like it's easier than we think to come into contact with these eggs in feces. You're picking it up out of the yard, you take your dog for a walk and doing that. Or I don't know if we would see it in cats too. I'm thinking like cleaning the litter box and stuff like that. It seems easier than we might think to come into contact with a method of fecal oral transmission.
Yeah. Again, humans think that they're like separated away from, the risk of wildlife disease things, and we're really in the thick of it. And we'd hear talking to a colleague who spent time growing up in Europe and would say his parents would tell them not to eat berries that were a certain height off the ground. They're supposed to eat the higher berries. And wasn't sure why as a kid, and now knows that their parents were encouraging them to not eat berries from a level in which could be contaminated with canid feces or other things. And so maybe the cleaner berries higher up. And so it's interesting to think about just all the ways that you can get infected with some of these diseases.
Yeah, absolutely. Gosh, I didn't even think about that one. So I guess what would put this on our radar if we were seeing a patient to say we should be thinking about Echinococcus multilocularis? What sort of clinical signs would we see in a patient that has this parasite?
It's so tricky. This is part of the issue and why I think we need a lot more just surveillance to get some more ideas. Because for many dogs, they are non-clinical. There was a recent series of 26 cases that was published, came out of testing done by Antech Laboratories, and half of those cases were routine wellness screenings in which they found Echinococcus eggs on their test. And so that's a problem, right? Then there's another half that had diarrhea, but that's again not super specific, would not raise your alarms. And a subset of those diarrheas had blood mentioned in the history. And in the case reports that were kind of already published, there is kind of a recurring theme that bloody diarrhea does seem to pop up. And for me, that is not consistent with tapeworms very often. And we talked about how like tapeworms like Diploidium don't cause a lot of disease, and we're treating because owners are freaked out mainly. But, if you were to see the eggs, so they're Taenia type eggs, and the clinical signs didn't fit with what you think a tapeworm is, just no clinical signs-ish, then it might be worth knowing more about that. And there's some molecular tests that can help kind of detect those eggs more specifically.
Interesting. So really, it sounds like symptoms or clinical signs, I guess is the correct term, can really run the gamut here, that we could have, asymptomatic. What you're saying makes sense, bloody diarrhea, and finding tapeworms to say, well, tapeworms generally aren't associated with this bloody diarrhea in our patients. It sounds like it's kind of an argument for running these fecal screenings on a regular basis for our patients with their wellness exams.
Yeah, I think, with tapeworm eggs, they don't float that well. And again, I mentioned they're Taenia type eggs in that Echinococcus and Taenia put out the exact same type of eggs. And so if you were to send a sample to me, and I was to look at a fecal, I would only be able to call them Taenia type eggs. And so you would need more molecular testing to try to ID those specifically and say, yes, this is Tania, like in a dog, Tania pisciformis, versus this is Echinococcus multilocularis. So it's another layer of challenge because, we've been looking at these eggs for a year and probably did the idea of, oh, well, it's a Tania type egg, but we mainly have Tania, so it's Tania. And we just move on without thinking about the concern. And now there's many groups that are thinking about that more and trying to make sure we know what those eggs are so that we're not just dismissing what is a very zoonotic pathogen when we send that patient back home.
Sure. Absolutely. I want to talk about clinical signs a little bit more and then hop back over to diagnostics because you mentioned liver and alveolar forms and things like that. Are those processes we're going to see in our canid patients?
Yeah, so in dogs, again, when they become the axonal intermediate hosts, we often see those alveolar or kind of blebbing cysts throughout the liver. And when you see those cases described, they're almost often first kind of noticed as what is a suspect liver cancer. Even either by ultrasound or something, they're looking and seeing that there are definitely multinodular cystic structures in the liver. And so can't really tell. There's not a good diagnostic test to say, oh yeah, we're just going to run some serum and see if this is a Echinococcus or not. So when we hear about these case reports, often they make it into a surgery in which they're thinking this is some kind of liver cancer. And unfortunately, when they get in there, the surgeons see that there's a lot of tissue damage to the liver and unlikely to have a good outcome. So they're euthanized on the table there just for kind of welfare concerns. Some of the cases I've been involved with, the surgeons even sent in, parts of the liver for histopath just to kind of see what kind of cancer this is, still thinking it was cancer the whole time and it being a Echinococcus. So there's really not a good option for that. And those cysts go pretty slowly. In humans, they say it takes about 10 years from infection to diagnosis-ish, probably shorter in dogs, but we're not diagnosing them, in a week or so, right? We're diagnosing them years later. So trying to figure out where they are exposed, how they are exposed can be really challenging.
Yeah, absolutely. Does that pose a risk to the surgeons who have this dog open and are exposed to the liver?
Luckily, not. So be unlikely that there'd be a risk in those dogs, right? If you rupture the cyst, it can kind of reseed the abdomen and things, which is what makes the surgical procedure difficult in general, even if it hasn't progressed to a major damage of the liver, but not a risk to the surgeons at that point. Although I think it is smart, and multiple of these groups have called me afterwards and said, "Hey, we opened up a dog and found out later it was a Echinococcus. Like, what do we need to tell our team?" And I think that's smart, at least having the trigger in your mind to say like, ooh, we do remember this is zoonotic and we do want to protect our staff. And so I have had a few calls like that with the surgical teams.
Sure. Just like you said, having it on the radar to say this could be a risk. What sort of precautions do we need to be aware of or potential exposures? Jumping back over to diagnostics for a moment, if we're talking about fecal screening and not liver biopsy diagnosis, you were talking about Tania type eggs. So it sounds like potentially beyond an argument for making sure that we're running routine fecal screenings, maybe doing these PCR tests as well to identify Echinococcus. Am I on the right track there?
Yeah, I think for the practicing veterinarian, there's a few steps to go through. The first is just the reminder that Echinococcus, the entire adult worm, is microscopic. And so when we're thinking about tapeworms, we're often thinking about owners bringing in proglottids and freaking out about something. And so if you're holding a proglottid in your hand in clinic, hopefully gloved hand in clinic, and looking at it, then that is not Echinococcus, right? The whole adult is like 4 millimeters, so they're super small. They're a tenth of the size of like one single proglottid of Tania. So if you're a clinic that puts a proglottid on a slide, smashes that up to see the eggs, I think it's a good idea. If you're seeing Tania type eggs on a proglottid that you just crushed up, that's Tania pisciformis in dogs, Taniaformis in cats. So lowers that risk. So that's a good first step for the general practitioners. If you're doing routine fecal floats and you're seeing Tania type eggs, that's where it becomes difficult to say, do we charge every client, to do more PCR on these floats? And I think if the clinical signs don't match up, maybe you don't do it, just warn the owner this could be zoonotic. They should pick up feces. Still going to treat with praziquantel, so no big deal. But as you kind of alluded to a couple times, there are some new diagnostic tests, and there's several companies and state diagnostic labs that offer a PCR that would identify those eggs. And that case series of 26 cases out of Antec came from their key screen, which is a PCR platform in which it tests the fecal sample for multiple different parasitic diseases. And so that's done on kind of well pet, sick pet. And that's where we're learning a lot of information about where these cases in dogs are, is that fecal PCR that's being done.
Sure, sure. No, that makes sense. And you also brought up praziquantel there, which is great because that was kind of where my head was going next was, okay, we either have this suspicion or we have this confirmed. What do we do about it? It sounds like if we're dealing with cysts in the liver and things like that, there's not a lot we're going to be able to do there. But, if we're identifying this on a fecal screen or something like that, how can we treat these?
Yeah, so praziquantel is the go-to, and that 5 mg per kg dose that you see on many preventives or labeled praziquantel products is effective against Echinococcus, Tania, and Diploidium. And so, again, in those general practitioners, if you were to see a Tania type egg and choose to treat with praziquantel and not ID it specifically, I think that's reasonable, right? We're still treating the infection appropriately, but you still might want to give the owner that information to protect themselves of like this could be a potentially zoonotic parasite. So make sure you just do good fecal cleanup and protect yourselves if you're not going to elect to do the follow-up PCR, which again, right now, I don't think we're in the place that every Tania egg needs to be PCR tested in general practice. Like I want that data and I want to look at that information, but we're talking about how we utilize our clients' money and information to give back to them. And I think sometimes in the laundry list of all the stuff we've got to do in these, just wellness exams, I think it's reasonable just to warn them of the zoonotic potential of Tania type eggs so that they can protect themselves.
That makes sense. Yeah. And just to be aware of what we're doing with, like you said, with the resources that we have, how we're using those. When we're talking about using praziquantel, one round of praziquantel, or do we need to follow that up?
For most of the cases, the way they're labeled is one treatment is effective against treating the intestinal stages, adults in the intestines. I would definitely recommend, follow-up testing. So if you were going to treat, it would be nice to retest in about 2 weeks to see if that worked. Often things that are just higher in the zoonotic scare, we decide that maybe we should treat again in a couple of weeks or keep this going, especially if you can't identify how this dog is getting infected or keep them from being infected. And so we have those dogs that are maybe just really good mousers, right? And so they're always out there hunting mice in the barn or whatever it is. And that's a real risk for reinfection because if we know there's that population of rodents in the area that are positive, it's going to be a hot spot. And so that dog maybe needs more routine praziquantel. So sometimes repeat treatments, I wouldn't say are necessary to clear the infection, but they may be necessary just to make sure that we're continuously killing off these adults. Because again, praziquantel is a pulse dewormer, meaning we're treating the adults and we're not preventing much. So if you send that dog back out tomorrow and it gets reinfected, that praziquantel yesterday was doing nothing. So now we got to retreat again. And so kind of keeping in mind what the risk factors are for these dogs and if more frequent praziquantel, like even in a monthly prevention style, might be helpful for some pets.
I'm glad that you brought that up because that was kind of where my head was going was, does it need to be part of their pulse deworming protocol? Are we seeing any concerns for resistance or anything like that?
When we think about praziquantel resistance, we are seeing some in Diploidium, and we don't really know much about that other than we've seen some cases and they're kind of, interesting to deal with. The resistance in Echinococcus would be unlikely just because there are tons of wildlife reservoirs out there. When we think about the population of the parasite that never sees a drug, so all those Echinococcus that are out there in wild canids are not seeing the drug. And Diploidium specifically is more of a dog-cat parasite. When you look at the wildlife, you don't find it very often compared to the Tanias, the Echinococcus in our wild canids. So I think the risk for us driving Echinococcus resistance is low, but I would agree that it's always thoughtful to evaluate our drug use. And again, that's why I mentioned a couple of times of thinking about your high risk patients or those that spend more time outside, those that, if they have a one-time positive for Echinococcus, that already moves it way up high on my risk. This dog probably needs monthly praziquantel because I actually never want to see this again in this dog, and I never wanted this family to be exposed to this ever again. And so, there's definitely specific case uses for monthly praziquantel when you're doing your risk analysis in the same way you decide how any monthly preventive makes it into your practice, like what's going to benefit my pet population that I see.
Yeah, and I think that is exactly what would go through many of our heads of, I never want to see this for this patient or for this family again. Thinking about that and having those conversations with pet owners to say, make sure you're cleaning up the feces in the yard and you're not being exposed in all these ways. Do, I guess, tapeworms in general, and more specifically Echinococcus, do they have any other clever ways of getting in if we have stuff out in the yard? I think of ground itch and things like that, hookworms and cutaneous larval migrans and ocular larval migrans with roundworms and things like that. Anything that we're seeing with tapeworms in that regard?
Yeah, they don't have any great mechanisms of infecting, percutaneous or anything like that. Their real mechanism is how hardy their eggshells are, right? And so they're able to survive in the environment. This is a parasite that we know spends time in the Arctic. Like the Arctic fox cycle is like an Echinococcus life cycle that we know and is well established in Alaska, at least in North America. And so these eggs are quite hardy in the environment. And that's why when we talk about prompt fecal pickup, it is really key because once it gets in the environment, we'd assume that environment is contaminated for a year to years to, life. And so that's a real challenge is how long they can just hang out and wait in the environment.
That makes sense. Yeah, and I always think about that with parasites that get into the environment of, sure, if you're putting pets on, pulse deworming protocols and things like that, but there's still wildlife around and things like that. I don't know how you ever really get rid of it in the environment. So yeah, just abundance of caution and trying to stay on top of it as much as we can.
Yeah, one of my previous colleagues at K-State would always say that, if you wanted your backyard to be free of parasites once you put whipworms or Echinococcus eggs back there, your options are so limited for feeling like they're completely gone. And that's removing the top 8 inches of topsoil, which is not very useful. Concreting over the whole thing, which, who wants to do that for their yard? And so there's really not great options once parasites get into the soil. They persist for a really long time.
I'm picturing taking off topsoil and where I live in Florida, there is no topsoil. We live on sand. And so it would be bad things would happen if we did that.
Be underwater.
Yes. Or, in a sinkhole, God forbid, or something like that. It would not work even if somebody was willing to do it.
Yeah.
Well, Brian, this has been such a great conversation. Thank you so much for joining me so we can learn more about this parasite, as terrifying as I still think it is. But at least, knowledge is power, right? We can stay on top of it and make sure that we're keeping our patients safe, keeping, their human companions safe as well. And yeah, just being aware of it.
Yeah, it's been a great chat. I'm glad that I didn't push your anxiety meter to a 10 out of 10. I could see it rising throughout the interview.
It always does with parasites.
Yeah. And just for last thought for me, I think veterinarians should get a big credit right now for the work that's being done. All the surveillance is being done right now in wild canids is being done by veterinary or wildlife animal adjacent groups. And the work is not coming from the human side. It's the veterinary side or the animal side that's putting in a lot of work for us to understand what the risk to humans will be. And I think, again, I always want to highlight and shout out veterinarians because we do a big lift on lots of the One Health work. And I'm really proud of the profession for what we are doing right now, looking at Echinococcus and trying to give people the best risk ideas that we can.
Absolutely. Absolutely. No, I love that you said that because, I think you're absolutely right that we have this different level of knowledge when it comes to zoonotic diseases and some of these One Health topics. And yes, shout out to the veterinary profession. I will give a shout out to the veterinary parasitologists who are keeping all of this data in mind and collecting it and using it so that we in practice, seeing these patients can try to be as effective as possible at keeping everybody safe.
Yeah, exactly.
Yeah. Well, Dr. Brian, thanks again. This was great.
It's great chatting with you, Dr. Cassie. I appreciate you having me on here.
Well, I don't know about you, but even as someone who admittedly several times over throughout this episode is very intimidated by talks around parasites, I really enjoyed this conversation. I learned a lot and I felt like I had some great takeaways. So I really hope that all of you out there listening enjoyed this talk as much as I did. Dr. Herron, thank you so much for joining me, and a big thank you to Elanco for making this episode possible. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast. It'll help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. As always, I'd love to hear your input on what you thought about this talk and what you'd like to hear from us in the future. So feel free to email me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM, or you can find me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.